Okay, let's unpack this. Today, we're diving deep into something pretty serious and fast-moving. Clostridial myonecrosis.
Right, which most people probably know as gas gangrene.
Exactly, gas gangrene. It's an infection that really demands immediate attention. We've looked at some key research here, and our goal is basically to pull out the absolute essentials, what it is, how scary fast it moves, the signs to look for, and, crucially, the treatment.
Yeah, making it clear for anyone listening, really, patients, caregivers, general public, what you really need to know.
So let's start right at the beginning. What actually causes gas gangrene? Where does it come from?
Okay, so it's caused by bacteria, specifically from the Clostridium family, and they usually get into the body through a wound.
A wound, like any wound.
Well, it's a particular risk after, say, major trauma or surgery, especially if there's quite a bit of tissue damage involved.
And the speed, that's one of the things that makes this so feared, isn't it?
Right. Critically so. That's a key point. These bacteria, they produce these incredibly powerful toxins, and they just love low oxygen environments.
Like in damaged tissue.
Exactly like damaged tissue in a severe wound. And because they work so incredibly fast, the severe pain, the real pain, can start just hours after the injury.
Hours? Wow.
That speed is, it's a defining feature.
Okay, just hours. So if it thrives like that and moves that fast, what does it actually, look like? How would you spot it?
Right, this is vital. The first big sign is often sudden, just excruciating pain in that wound area, often way, way worse than you'd expect from the injury itself.
More pain than seems right. Got it.
Then you need to watch the skin, right around the wound. It might look sort of shiny and tight at first,
Okay.
but the really alarming thing is how fast the color changes. It can go from looking a bit dusky or maybe bronze, and then rapidly darken. We're talking deep red, even black.
That's quite a visual and incredibly important to know. Are there other signs? Things you can physically see or feel?
Yes. You might see blisters forming on the skin. The medical term is boule. And sometimes they have this distinct kind of sickly, sweet smell.
A sweet smell, okay.
But maybe the most characteristic thing, and it's where the name gas gangrene comes from, is, gas in the tissues.
Gas in the tissue.
How would you know? You might actually feel it, or sometimes even hear it, like a crackling or a popping sensation under the skin. That's called crepitus. It's literally gas produced by the bacteria.
Crepitus, okay.
You have to remember, this whole process is aggressive. It spreads incredibly fast. Someone can seem unwell, and then boom, within maybe 12 hours, they're critically ill, life-threateningly ill.
So intense, sudden pain, the skin changing color really fast, blisters, maybe that smell, and the gas, the crepitus. Those are the big red flags.
Definitely.
But why? Why are these bacteria and their toxins just so destructive so quickly?
That's a crucial point. It's not just that the bacteria are multiplying, it's the toxins they pump out. The sources mention things like alpha toxins.
Toxin.
Yeah, and these aren't just minor irritants. They actively destroy muscle, other tissues, just incredibly rapidly. This causes massive damage locally, but it also triggers a huge response that affects the whole body.
So the speed is down to these toxins just wrecking everything in their path.
Pretty much, yeah. Working overtime.
Given that kind of speed and destructive power, treatment must have to be incredibly aggressive.
Yeah.
And fast.
Absolutely. There's zero time to lose. The sources are really clear. This is a full-blown medical emergency. It needs a rapid, multi-pronged attack.
Okay, so what are the prongs?
First pillar. Immediate surgery. You have to go in and meticulously remove all the dead and infected tissue. That's called debridement.
Debridement. Get rid of the environment the bacteria love.
Exactly. And get rid of the tissue where those toxins are just spreading.
Makes sense. And you need to hit the bacteria directly too, right, with antibiotics?
Precisely. Powerful antibiotics are essential. The sources mention ones like penicillin and clindamycin, given immediately intravenously to target the bacteria systemically.
Okay, so surgery for the damaged tissue, antibiotics for the bacteria. But the sources also mention hyperbaric oxygen therapy. HBO2, breathing pure oxygen under pressure. How does that fit in?
Yeah, that's a really interesting part of the strategy. So hyperbaric oxygen therapy, or HBO2, you're basically flooding the body with high concentrations of oxygen under increased pressure.
And how does that help here?
Well, two main ways. First, the high oxygen levels directly inhibit these Clostridium bacteria because, remember, they hate oxygen.
Right, they like low oxygen spots.
But maybe even more importantly, the extra oxygen dramatically reduces the production and the activity of those devastating toxins, especially that alpha toxin we mentioned.
Whoa, so hyperbaric oxygen isn't just like slowing the bacteria, It's actually disarming their main weapon, the toxins.
That's a great way to put it, yes. It works together with the other treatments. Surgery removes the dead stuff, antibiotics kill the bacteria, and
Oh.
HBO2 helps protect the healthy tissue that's still viable from further toxin damage.
So it improves the chances of saving tissue, maybe even limbs.
Exactly. The sources suggest that using HBO2 alongside surgery and antibiotics seems to lead to better survival rates and, yeah, fewer amputations compared to just surgery and antibiotics alone in some studies.
That really paints a picture of how you need all three potentially working together.
Okay.
So, boiling it all down, what's the absolute key takeaway for anyone listening?
The most crucial message is gas gangrene is a time-critical emergency. If you see those signs, the rapid, severe pain, the fast skin color changes, blisters, that weird popping or crackling under the skin around a wound, especially after trauma or surgery, you need medical help immediately. Go straight to the emergency room.
Don't wait. Do not wait.
And the most effective treatment is that fast, combined approach. Surgical debridement, strong antibiotics, and often hyperbaric oxidase therapy.
That terrifying speed really sticks with you. It defines the whole thing. Considering how incredibly fast this infection moves and the kind of layered, all-hands-on-deck approach needed to fight it, it really makes you think, doesn't it? How understanding that race against the clock highlights just how critical rapid recognition and response are for any serious wound. Something to keep in mind.